3 signs to spot a therapy scammer. Hi, I'm Dr. Nikki. I have over 20 years of experience working with individuals who struggle with complex mental illness to help them feel better and free themselves from the constraints of their mind. I'm here to provide and share some knowledge, to answer your questions, and help you fill those critical thinking skills. Number one, and this is really important, make sure that your therapist completes an intake. The intake might be structured where you answer questions. Your therapist will ask you questions, you answer them. Or it might be unstructured where you're going into your past, talking about your development and current situation. So the reason why the intake is so important is because therapists like myself need to gather information as best as we can to understand what has happened to you, what is happening to you, who you are, and what you've been through. Have you been to therapy before? Have you not been to therapy before? Has it worked? Has it not worked? What has worked? What do you find that's important? What's not important? Do you have a diagnosis? Do you identify with a particular disorder or a cluster of symptoms? We need to know this information so this way we can organize all of that data and present you with a personalized treatment plan. Number 2, if your therapist doesn't provide you with a treatment recommendation following the intake assessment, then definitely run, because then your therapist most likely doesn't know what they're doing. If the therapist doesn't articulate the treatment plan, then ask the therapist, hey, I just want to know, what is the plan of action moving forward? And then if your therapist says, okay, this is what's going on, X, Y, and Z, here are your presenting issues, here are the barriers to treatment, this is what I think is going to be helpful for you, and this is where I think we can start. Fantastic. Your therapist knows what they're doing. They've gathered the information, they've conceptualized it, they've understand it based on their theoretical orientation, their skill set, their experience, and now they've devised a treatment plan that is particular to you, and they've articulated that. Wonderful. If the therapist has no clue, if the therapist is unable to say, hey, this is what's going on in the treatment, or this is what I plan to do, or this is what I think is important in terms of where you need to process or where you need to strengthen your skill set or something along the lines, then definitely run. Number 3, if your therapist is not taking your feedback into consideration and modifying the treatment recommendation based on progress or limited progress, what has happened in treatment, then that is a huge red flag. If your clinician is able to say, here's the reason in which I recommend this path as opposed to this path, great. Now you have an understanding, you've articulated what you need for yourself. Your therapist has clearly articulated and presented to you why they're doing what they're doing and why maybe your feedback or recommendation might not necessarily be so helpful. It is also a red flag if you have a people-pleasing therapist. Oh yeah, no problem, we'll include this. Oh yeah, we'll do this. Or yes, everything is good here. That is a big red flag too, because not only do you need your clinician to help support you in terms of creating a safe space and validating, but it's also important for your therapist to point out when you need to be challenged or when your line of thinking isn't rational. You have control. And if you're not getting what you need, get out and find a therapist that is most suitable for you and that is competent, can help you get to where you need to be.